need to talk about Kevin is a psychologically suspenseful movie. It is a story describing a boy whose abnormal development led to a clinically significant disorder ending in a mass murder. It is obvious Kevin's mother, Eva, did not want the child while his father did. This caused Eva to express signs of postpartum depression after she ended up delivering the child.
Between 2 and 5 years, Kevin's relationship issues with his mother began to manifest. Kevin had delayed verbal language skills and had a difficult temperament, aggravating his mother. Between 5 to 11 years, Kevin's manipulative and deceitful behaviors progressed. Through these behaviors were only evident to Eva. He is oppositional and defiant to his mother, while he establishes a fictitious bond with his father, exemplifying his manipulative ways. He does this when he refuses to potty train, and his mother accidentally breaks his arm as a form of punishment. Kevin uses this to manipulate his mother.
In adolescence, Kevin shows high analytical intelligence through exploiting his mother by planting his sister's hamster into the carburetor for his mother to kill. Kevin has a distorted view of sex. His only hobby is one of violence and aggression. Kevin shows a grandiose sense of self through his smug demeanor. Kevin also shows lack of mood swings, meaning he is in control of his emotions or lack thereof. He especially shows no signs of guilt or sympathy. All factors eventually lead to Kevin's plan of a mass killing of his classmates using a bow and arrow, and the succession of events leads to the inevitable murder of his sister and his father as well.
Given the background information we just described, we are now able to begin the diagnostic assessment. We compiled an idiographic case formulation while making naturalistic observations. We made many considerations when looking at Kevin's problem. Eva tends to see Kevin as deceiving, manipulative, destructive, evil, conning, and threatening, while Kevin sees himself as unemotional, different, superficially charming, destructive, and manipulative. The behaviors began at early childhood or infancy. Behaviors also became more and more prevalent and obvious between 2 and 5 years and continued to develop and become more threatening in his adulthood. During prenatal care, Eva did not appear to have any physiological complications throughout her pregnancy. Eva was not mentally ready to have a child, as she vocalized to her husband, and that vulnerability after a fight she had with her husband ultimately led to sex and the conception of Kevin. Her prenatal although prenatal care was attended, Eva appeared uncomfortable, easy, and fearful throughout her pregnancy. During Kevin's birth, Eva resists against the urge to push when she is told not to. The doctor tells her repeatedly to stop resisting, and resisting to push or tensing of some muscles during birth could significantly add to stress of the mother and the child. This stress could ultimately affect the amount of oxygen Kevin is receiving while he is being born, and this could lead to significant developmental problems. Postnatal care. Kevin appears to be colic in the presence of his mother. He is high-pitched screaming for extended periods of times during his infancy, and he also does not appear to have formed a significant attachment with his mother. His mother is also showing signs of postpartum depression. She has depressed mood swings, and overwhelming fatigue and loss of energy. Kevin's medical history does not appear to affect his psychological development, although he does have a more difficult temperament, as stated by his doctor. Age-related milestones. Kevin has delay in motor, language, and toileting. His motor, he does not engage in play, and in terms of engaging in conversation, he doesn't do much talking around 4 and still wears diapers around the age of 6. Kevin's personality fits into cluster B personality disorders. He is dramatic, unpredictable, and has unpredictable thinking and behavior. He also exhibits antisocial tendency throughout life, like lack of remorse or shame, and proneness to boredom and need for stimulation. He also is unresponsive to interpersonal relations. In terms of his mood and emotion, you don't see the mood fluctuations that you would typically see during adolescence and in between the ages of 2 to 5 and 5 to 11. Kevin also stays calm and appears unaffected when his mother attempts to make him angry or put him down in all scenes during his adolescence. In terms of his social relationships and interactions, he's never really seen with friends and uses his relationship with his father and sister as mediators in order to manipulate his mother. His lack of sexual relationships shows that he does not create relationships at school or has any other significant relationships with women. He also bullies his sister and shows violence through murder, and he has animal cruelty and inappropriate social responses. In terms of a functional analysis, an example of an incident would be when Kevin was 6 years old. Kevin proves his intelligence and ability to make his own decisions and plan. His mother attempts a different, less frustrated approach and calmly changes his diaper. The behavior that came from that is when Kevin stands up and stares at her with spite and defecates immediately after. Eva, frustrated and angry, grabs him and throws him back on the changing table, to which he falls and breaks his arm. The consequences after those behaviors are Kevin does not verbally blame her or tell anyone about the truth of how he broke his arm. Instead, he repeatedly uses his scar from the accident to guilt his mother into what he wants.
We decided that we would be diagnosing Kevin with conduct disorder with psychopathic tendencies. The conduct disorder in the DSM-5 is described as a repetitive and persistent pattern of behavior in which the basic rights of others or major age-appropriate societal norms or rules are violated, as manifested by the presence of at least 3 of the following 15 criteria in the past 12 months from any of the categories below, with at least 1 criterion present in the past 6 months. The first being aggression to people and animals, so bullying, physical fights, using a weapon, or physical cruelty to people or animals. Destruction of property, so if they've deliberately engaged in fire setting with the intention of causing serious damage or deliberately destroying other people's property. Next, there's deceitfulness or theft, so if they've broken into someone else's house, car, or building, lying to obtain goods or favors and to avoid obligations, or has stolen items of non-trivial value without confronting a victim. Next, there's serious violations of rules, so if the individual stays out late at night despite parental prohibitions, beginning before the age of 13. And these individuals are often truant from school, also beginning before the age of 13 years. Also, the 2 other categories, the disturbance in behavior causes clinically significant impairment in social, academic, or occupational functioning. If the individual is of 18 years or older, criteria are not met for antisocial personality disorder. So some cognitive and verbal deficits that these individuals will face are ones that are of conduct disorder or interfering with the development of self-control, emotion regulation, or labeling of emotions in others, which may lead to lack of empathy along with others. Some social and learning problems are, although the frustration and demoralization associated with school failure can lead to antisocial behavior in some children, there's little evidence that academic failure is a primary cause of conduct problems. Over time, underachievement and conduct problems influence each other. Family problems. High levels of conflict are common in families of children with conduct problems. So too are poor parenting practices such as ineffective discipline, negative control, inappropriate use of punishment and rewards, failure to follow through with commands, and lack of involvement of child rearing. Lastly, there's peer problems. So preschoolers who show self-regulation have difficulty understanding the perspectives of others. They experience corporal punishment from their parents and display higher levels of peer aggression. Friendships between antisocial boys are abrasive, unstable, of short duration, and not very productive. Aggressive children also show distortions in how they think about social situations.
Theories of causation. There are 2 main theories of causation that we look at when assessing Kevin and his antisocial personality disorder. The first one is the coercion theory, which its main basis is centered around parent-child interactions. The main idea here is that children learn to cope with their unwanted parental demands through their antisocial behavior, and this is an ongoing cycle. So the mother's bad behavior affects the child's bad behavior, and so on. And this can be applicable to Kevin through his interactions with Eva. For example, when she breaks his arm, when he talks back, when he is counting, and so on. Another theory is the attachment theory. The main basis here is that parental attachment is so important to child development, and this will lead to the child aligning with the parental values, beliefs, and standards, which is how they have a stake in society and shows them how to function in society. This is evident in Kevin through his relationship with Eva. It's obvious that he doesn't gain the attachment that he needs due to her postpartum depression. Another cause, which isn't exactly a theory, is just how media affects Kevin, and this can aggressive media can trigger aggression in children, and it can make them desensitized to other people's suffering and pain, which we see in Kevin. He has lack of understanding of other people's emotions or insensitivity to them. In the movie, you can see him playing with video games with his dad, and he yells, "Die, die, die" at the TV. As for treating Kevin and preventative measures, we want to take a two-pronged approach here, which is early intervention and ongoing interventions through his youth and coping with family and social support and academic support as well. There are three main treatments for antisocial personality disorder. The first is parent management training. This teaches parents to change their behavior at home and other settings using contingency management techniques. This basically is under the belief that better interactions will be improvement in child behavior. And this goes with the idea that parent-child interactions are at least partly responsible for the child's antisocial behavior that we see with the coercion theory. Another type of therapy is the problem-solving skills training. This identifies the child's cognitive deficiencies and distortions in social situations and provides instruction for handling new situations. This is a form of CBT, and it often co-occurs with PMT as well. The final therapy or treatment that we look at is the multisystemic therapy, and this draws upon the other two training that we just talked about, and it also goes along with marital counseling, which is needed between Eva and Franklin, and this attempts to address the severe causes or determinants that seem to cause this antisocial personality disorder, and this has better long-term effects than the other two. So this is the winner. This is the one that we believe should be used with Kevin. It's a multifaceted approach. It has long-term benefits. It uses all of them, and it will reduce his hostile attribution bias, and so on. Some preventative measures is that he should have been treated earlier on, like when he had the languages and verbal issues. It should have been addressed or looked at then. The relationship with his mother is a huge risk as well, and if these preventative measures were taken, he might not have gone to extremes like he had in the movie.
Now we are able to look at the stigma surrounding conduct disorder and the film's depiction of mental illness. So in terms of public perception in the film, the public sees Kevin as someone who has antisocial behaviors, as a person who is a criminal or offender. Kevin's father, Franklin, is unable to see his son's behaviors and interests that are visible to him as abnormal or slightly off. He struggles to see the underlying problems in his relationship and also struggles to see the child as different from normal. Kevin's mother fails to seek professional psychological help as the men in her life ignore her emotional response and remain naive to the deep-rooted problem. In terms of stigma surrounding conduct disorder in the film, societal perception after the shooting continues to place significant pressures on the family, preventing them from getting real psychological support. Kevin's father's inability to trust his wife's feelings due to his discomfort surrounding the idea of his son having something wrong with him also increases the stigma. Kevin's mother sees a psychologist once, but this doesn't really do anything in the long run, as it's a way to help herself cope. There's no real therapeutic intervention that comes from her seeing the psychologist, and therefore there's no actual help for Kevin. In terms of the film's depiction of mental illness, there are some pros. Overall, the film does a really good job of portraying mental illness and the consequences that can come from miseducation of child and familial problems. It does do a good job on capturing the struggles each character experiences, and also does a good job on showing the implications of stigma around mental illness. Viewers are able to empathize with the characters, but it also leaves them feeling frustrated with the lack of help received. All the struggles shown are often common implications of mental illness, and the movie also promotes cognitive thought in the viewers to recognize the struggles and discover preventative measures. Some cons are that the movie fails to show the benefits that can be accomplished from receiving legitimate psychological support and intervention. This can lead viewers to feel hopeless if they have a child that has a mental illness, and it really doesn't promote further education surrounding the impact that professional help can have.